The dengue fever outbreak in Samoa has reached nearly 11,000 cases since January, with at least 6 deaths. A small team of New Zealand personnel have been on the ground assisting Samoan authorities, and among them is Dr. Goodey, the clinical director of that New Zealand medical assistance team, who joins us now there from Hamilton. Good morning, Doctor. Good morning, Alan.
Good morning, Garth. Great to be here.
Yeah, I just great to be back, but it sounds like you've been pretty needed over there, yeah?
Yes, the Samoan medical team have been doing a sterling job before we got there, and working really, really hard. But they were also getting quite tired, and we were able to give them some much-needed support.
What sort of support are we talking about, and what exactly, I mean, for those that maybe aren't even familiar with what dengue fever is, what are you dealing with?
Well, you've already mentioned that 6 children have died, and firstly, my thoughts and my team's thoughts are with their ainia or family. At this time, it takes a lot to get over that sort of event in your lives, and not to mention just the loss of these young lives. But it affects a large number of people don't even actually know that they have dengue or only have very mild illness. But around about 1 in 20 get a severe form of dengue, and they can have really terrible headaches, pain behind the eyes, high fevers, and then they get abdominal cramps and pain and can't take in fluids. For that group, a small number then get on and they can go into a form of shock where their capillaries leak and they become very dependent on assistance getting enough fluid into them. And a small number also can have bleeding issues.
And are you getting out to communities with this team, or is it mostly about relief in some of the bigger sort of health clinics and hospitals and places like that?
So we've basically assisted in 2 ways. We've had teams at the main hospital in Apia, TTM, and that's included some paediatricians and some assistants in their very busy outpatient clinic, where a lot of the patients can be managed as outpatients. And then secondly, we've assisted at one of the district health centres, Faliolo, which is close to the airport, where a lot of the cases were concentrated, providing additional resources there, assessing, again, mostly as outpatients, but a number of those patients would be admitted to that small hospital and helping with referral when they needed to go on to the main hospital.
And this is sort of support. Can you talk me through a bit about where the financial support, the ability for people to be there is coming from?
So this is funded by the New Zealand government through the Ministry of Foreign Affairs. It's part of the humanitarian program that the New Zealand government provides, supporting our neighbours around the Pacific.
So this is just, this is us just basically being good neighbours and trying to do our bit in a moment of crisis. I mean, are there things that they're doing to try and prevent this from being a problem? It's a mosquito-borne disease mostly, isn't it? Are there things that are happening there?
So it is spread just by mosquitoes. So an infected person is bitten by a mosquito, it then incubates in the mosquito for a few days, and then if that mosquito bites another person, they can catch dengue. So there's major efforts in Samoa and right across the Pacific to control this particular species of mosquito. Luckily, we don't have it currently in New Zealand.
Yeah, and you guys were there for work. For people that are travelling there for other reasons, probably more for sort of holidays or perhaps to visit family and so on. What is the advice that they should be taking about how to prevent, adding to that list of 11,000 who've caught it?
So there's really good information on the Safe Traveller site from the New Zealand government, but essentially it's don't get bitten by mosquitoes, and so taking proper precautions around that.
Dr. Goodey, the clinical director of the New Zealand medical assistance team that's been over in Samoa helping deal with dengue fever. Thanks very much for some really useful tips there.